statins and diabetes. In short, it's a real risk that should be talked about, but one that typically happens in people with increased risk already: obesity, prediabetes, and metabolic syndrome, and in the setting where, if they have high blood sugar, they're at much higher risk from high cholesterol. So it needs to be a balanced discussion. If a patient was worried about insulin resistance or had high risk for it already, or was developing it, they can go on alternative treatments like PCSK9 inhibitors or bempedoic acid, at least until misinformation accounts know enough to start targeting those safe, effective drugs with misinformation. For statins and the question of diabetes risk, though, it's a legitimate conversation I have with patients. A classic meta-analysis of 13 randomized trials, including over 57,000 patients, found a relative risk of 1.13 for incident diabetes among statin users versus none. In absolute terms, the risk is there, it's real, but it's also small and should be put in context. For example, some estimates suggest that for every 255 patients treated with a statin over 4 years, there might be one additional case of diabetes, but that same treatment would prevent 5 major cardiovascular events like heart attack or stroke. And if you're a good doctor, you can identify patients that would be at higher risk of diabetes on a statin, use low dose, counsel on the risk, and check for it. For statin treatment and diabetes, it's not like it happens immediately. Surprise, you have diabetes. You can check for it developing. You know people that are afflicted by obesity, prediabetes, and metabolic syndrome, that they're at high risk, but they're also the very ones that benefit most from cholesterol treatment. You can counsel, watch closely, and understand the treatment benefit versus risk. If you're on fire, it's scary to focus on the potential toxicity of the fire extinguisher foam, but you're on fire. You need to put it out or you will be harmed worse. Overall, it's important to make decisions based on reality, on good medicine, not on fear derived from misinformation from social media, especially when it's fear-mongering from people that didn't go to medical school or can't prescribe these drugs in the first place.